Hello, my name is Dr. Gregory Dorr, and today we're going to demonstrate a lumbar erector taping using TheraBand Kinesiology tape. Now, the application that we're going to be using here is a neurologic application, meaning what we're trying to do is improve our muscles' ability to contract through concentric and eccentric loadings. So what we're going to do with our patient is we're going to let him lean right over our exercise ball, and we're going to measure from mid-sacral level to the upper or lower thoracic spine into the lower ribs. Now, in order to make two strips of the exact same size, an easy way we can do this is simply fold the tape over itself, and now we have two exact same strips for the low back. With our scissor, we're going to make our first cut away from the roll, and because we don't want the sharp corners to catch clothing, we're going to round these corners. And with the strip that is still held together, we're going to make another rounding of our corners up here. And that will separate our two strips into two equal strips. In order to apply the tape, we're going to break the backing of the tape simply by separating it, pulling it apart. And each strip will start on the left side here first. We're going to peel that backing off of the tape. We'll apply the tape to that mid-sacral level. And now the patient's already on a stretch position. So what we're going to do is make sure with our exact stretch indicator, which are these small hexagons, when they become equidistant, that means you're at a 25% stretch on the tape. So we want to make sure that when we're applying this, that we don't stretch beyond that point. This would be the maximum stretch we would apply to the tape. However, you could go as little as no stretch on the tape. And now we're just going to use what we call paper off tension and apply the tape up. An important thing to realize when you're applying kinesiology tape is that last 10%, never put any stretch on it at all. This is the area that we get the most irritation associated with kinesiology tapings. And then we're just going to lay it down. Now, because kinesiology tape and the TheraBand kinesiology tape is a heat-activated adhesive, we always want to make sure we rub that tape afterwards to activate the adhesive. And one thing we can also do is using the backing of our tape, because if we rub back at the edge here, we have the chance of peeling the tape back and ruining our tape job. However, with the backings, we can go right over the skin, create the same heat adhesive stimulation, but we don't have to worry about catching the edge of the tape and peeling it back. So now we're going to go to the right side. We'll apply our second strip. Once again, an easy thing to do is just pull that tape apart so the backing comes off nice and easily. We're going to apply it the exact same way right over the erector muscles. As you can see, there is no stretch placed on that base. And once again, we can do some paper off tension, just peeling the backing as we use our finger behind the tape and bring it up. And once again, just make sure that last little bit has no stretch on it. Apply. And once again, we can use our backing and activate the adhesive. With the exact stretch indicator, again, make sure that you're looking at your small hexagons and you notice that they are of equidistance or less. For more information and applications using TheraBand kinesiology tape, visit therabandktape.com.